Life insurance, by the way, you can do that with auto insurance. You should be able to do it with your health insurance. And I will say there was one of the few good things, there was actually a provision in the Baucus bill that would have allowed this. And there was a vote last week to strip that out of the Baucus bill, so that's gone now. But that seems to me to be just plain common sense. You know, we also need to open up competition in terms of providers. We need to have tort reform. We need to do things in terms of bringing down, deregulating insurance to bring down the cost so young and healthy people have an incentive to buy into the system. A lot of things we can do. Ultimately, we face one very simple question. And let me close with that. I think it's the question of politics, by the way. And that is, who decides? Now, if we break all politics down, that's the only question that really matters. You know, all the isms that are out there, liberalism, conservatism, libertarianism, socialism, Marxism, that's what they're all based on. Pick your issue. Who decides where your kids are going to go to school? You or someone else? How about what charity you're going to support? Do you decide that? Or does someone decide it for you? Or how are you going to save for your retirement? Is that your choice or someone else's? And when it comes to health care reform, who decides what kind of health care you're going to get? Are you going to get to make those decisions with your doctor? Or is someone else going to make those decisions for you? And you can answer that question, then you can come up with an answer about health care. Thank you all very much. Really appreciate your listening. Questions? Yeah.
Aren't we too far down the slippery slope now for any of these things to really change? And another thing, tort reform. That can, if we get decent tort reform, that's going to reduce 20% from the top. Now, Obama said they're going to study, quote, study tort reform.
Yeah, and have some demonstration projects. On the first one, are we too far down the road? No, actually, I think right now we are poised on the knife's edge. I think everyone pretty much admits the current system is unsustainable. And the question, are we going to tip to government control or to consumer control? And that's the debate we really should be having. And I think it could tip. I think it could tip either way. Why are we not having that debate? Because I think, frankly, too many people on the conservative side, and particularly in the Republican Party, don't want to talk about health care reform. I mean, I can go all the way back to Hillary Care. I was involved in the Hillary Care debate back in '93 when Bob Dole said to me, "Health care is not a Republican issue. The best we can hope for is to get it off the table as fast as possible." And I think that's just wrong. There are good free market ideas about health care, but too many Republicans don't want to talk about it, and they should be out there talking about them more. And that sort of left a one-sided debate, and I wish that people who believed in markets would go out and sell them more. In terms of tort reform, I think we need it, but I'm skeptical of the level of savings. There are no good real numbers out there. There's two parts to tort reform. One is the actual premiums that the doctors pay. That's a minuscule part of healthcare costs. It's about 1/2 of 1% of healthcare costs, and it primarily affects certain professions in certain areas. OBGYNs, neurologists, and anesthesiologists are going to be sued, and their premiums are through the roof. If you're some other profession, your premiums are not. I don't want to minimize them, but they're not as terrible. And it depends where you are in the country too. Nevada, Pennsylvania, South Florida, you're in real trouble. But other parts of the country, not so bad. The bigger question is defensive medicine. How much defensive medicine is going on? And it's very hard to measure that, because it's very hard to say what is defensive medicine and what is not. What is good defensive medicine? There's some defensive medicine we want, some defensive medicine that's wasteful. Trying to parse those out is very hard, and the studies are all over the lot. Some do go as high as 20%. I think that that's probably way too high. I think it's probably somewhere in the 7 to 10% range, but that's just my guesstimate, my best guess.
What article in the U.S. Constitution permits the federal government to involve itself in our health care?
Yeah, there's one we haven't won for a while. Of course, I mean, they will then argue it's the General Welfare Clause, which of course we know is nonsense. The General Welfare Clause was actually a limitation on the enumerated powers, saying the enumerated powers could only be used for the general welfare, not for what they called factions back then. It was not intended to be an open-ended grant of power. We're not going to win that one. There is a strong question about whether or not the individual mandate is constitutional. They're trying to peg the individual mandate on the Interstate Commerce Clause, and there's a good question about whether or not that could be used to force people to buy a product, or as opposed to regulating the product, which Congress has long asserted is an interstate commerce provision. You know, we don't know how that's going to go. It's never been raised. In fact, the individual mandate is pretty much unique. The Congressional Budget Office looked at this and found only two other things that are requirements of citizenship. This is not like the president always compares the individual mandate to the mandate for auto insurance. But driving's always been a privilege. You can put all sorts of restrictions on it. If you don't have a car, you don't have to buy auto insurance. This would be a requirement of citizenship. You're a U.S. citizen, therefore you must do X. The only other two things that exist are taxes and the draft. Those are the only other two provisions that fit that definition. Whether or not a requirement that you buy a product could hold up under scrutiny is an open-ended question right now. Yeah?
There was an article on the mandate this morning in Wall Street Journal, and it's excellent. It goes to your point. Secondly, one of the things that I do not believe you have really touched on is what happens when suddenly we do not have young people going into the field of medicine because of this.
Yeah. Yeah, that's a huge problem. Right now, is essentially foreign-born doctors are keeping the medical school enrollments even, but we actually have been losing people from the practice of medicine, U.S.-born, for some time. It is partly that they don't like dealing with the insurance companies either. They're going to hate dealing with the government just as much, but it's a general feeling of bureaucratization of healthcare that's driving doctors out. In addition to that, the question is going to be, what are the reimbursement rates that are permitted in the future? We know that right now, Medicare and Medicaid under-reimburse. Medicare pays about 80 cents on the dollar, Medicaid about 70 cents on the dollar, which is why a third of doctors no longer accept Medicaid patients, 12% of doctors don't accept Medicare patients. Well, under the new public option, if they create that, what will be the reimbursement rates? On the there was going to be Medicare rates plus 5%, so they would only under-reimburse by 15%. Whoopee. Under the House bill, they started off with simply the Medicare rates. The Blue Dogs objected to that. They said, okay, instead of having any provision in here what the reimbursement will be, we'll let the Secretary of HHS negotiate what those rates will be in the future, which is sort of like negotiating with Tony Soprano. So we'll have to see. But if they start under-reimbursing, we're going to see more and more physicians opting out. Massachusetts is a big example of this, some more of Romney Care. They put in place the mandate and then the subsidies up there, so they've got more demand for doctors. There's more people are insured, they're wanting to see doctors more, so there's more demand for doctors. They also blew their state budget wide open when they put in this. They've already had one tax increase, a number of fee increases, and they're still somewhere between $2 and $4 billion unfunded going forward over the next 10 years under the program. So they've come back and said, we're going to have to cut reimbursement rates. They're going to do away, they've already come up with a commission that's going to recommend doing away with all fee-for-service medicine in the state, put in all capitated payments. They've even talked about the idea of a global budget in the state for healthcare spending. And they've been, in the meantime, they've been pushing insurers, they've been threatening insurers into cutting back reimbursement rates by about 3%. As they've done this, the doctors have stopped seeing new patients. They've stopped saying, I keep my current practice, but I'm not going to see anybody new. The result is, for the first time, we're seeing waiting lists for care in Massachusetts. The wait to see a primary care physician in the state has gone from 33 days to 55 days since the program began. So it's now a 2-month wait to get in to see a doctor in the state. And in some parts, in the western part of the state, it's 3 months or longer where there are fewer doctors. So we're not